Patient lying on prone, yeah, patient lying on the front, and then you trying to kind of the surface you palpating should be slightly below the hip height. Okay, it shouldn't be above the hip height, or it shouldn't be below the hip height. If you below the hip height, it should be slightly below the hip height level. You got me? So you need to raise the height or adjust the plinth height so that it's comfortable to you. Next, once that patient is comfortable, you need to go close to the patient and then palpate the spinous process. The next step is palpating the spinous process. To reach the lumbar spine, there are two methods to reach the lumbar spine. One, you could come from the top of the iliac crest. You can come from the top of the iliac crest. If you come across, if you palpate the spinous process which is broad and thick, if you go one level below, if it's round and sharp, the level you reach from the top of the iliac crest is at L4. If you coming from the top of the iliac crest, you're coming across the spinous process which is broad and thick. If you go one level, or if you say, for example, if you're coming from the top of the iliac crest, if you're palpating a spinous process which is broad and thick, if you go one level below, if that's broad and thick, the level you reached is L3 spinous process. If you're coming from the top of the iliac crest, if you reach a spinous process which is small and round, then the level you reached is L5 spinous process. So there's only three possibilities. You might either reach L4, you might either reach L5, or you might reach L3 spinous process. Now that variation, whether it's L3, L4, L5, variation depends upon the curvatures of the spine. If someone who got increased lordotic curve, when you come from the top of the iliac crest, you might reach the L3 spinous process. Someone who have got flat lumbar spine, if you come across, you might reach the L5 spinous process. So the level you reach might vary, and that's why we're going to use some reference to see whether you're reaching the L3, L4, L5 spinous process. The second method of reaching spinous process is palpating the posterior superior iliac spine. If you palpate posterior superior iliac spine, if you draw a line connecting both PSIS, the midpoint of the PSIS is the L5 spinous process, or its junction between S1 and the L5 spinous process. So once you reach the spinous process, let's say if you reach the L4 spinous process, what you need to do is to place your pisiform bone. So with your whatever your dominant side is, whether your right side dominant, left side dominant, doesn't matter. What you need to do is your dominant wrist, place your pisiform bone onto the spinous process. Can you see? So once you place the spinous process, so pisiform bone on the spinous process, this hand needs to be reinforced with a non-dominant hand. So you kind of creating that V shape going across the wrist. Can you see my wrist position? 3 fingers coming onto the front and then 2 fingers going on the back. So 3 fingers on the front and then the 2 fingers back, and it's much more C-shaped. And my non-dominant wrist is above my dominant wrist. Can you see that? Yeah? And then you place your wrist onto the spinous process, pisiform onto the spinous process, reinforced with the non-dominant hand. Yeah? And then you need to go close to the spine with your shoulders above the spinous process. If I stand far off from the spinous process, I'm putting too much pressure on my back because there's a gap between my trunk to the spine is far away. Am I right? So you need to go closer to the patient, place the spinous process, and then your shoulder, both shoulders should be above the spinous process. You with me? So once you got the correct position, then you apply grade. The grade you're going to apply is maintenance grade. So you're going to start from grade 1 and then progress down to grade 4. If at any particular grade, if the symptoms reproduce, you need to stop there. You should not progress to the next grade. You are using it for diagnostic purpose. You're trying to check the function. If you identify some problem in that particular joint, you should not progress to the next grade and then make it much more big, not aggravating the symptoms by going on to the next grade. So if the symptoms reproduce on grade 2, then you need to stop and make a note rather than continuing doing grade 3 and grade 4. If the symptoms reproduce on grade 3, you need to make a stop and then make a note and then progress to the next level rather than at the same level. Does it make sense? So you need to start with always with the grade 1. And the grade 1 is a small amplitude oscillation at the beginning of the range. So grade 1 is a small amplitude oscillation, very small oscillation. 3 oscillations at the beginning of the range. With me. Grade 2 is a large amplitude of oscillation. So starting from the beginning, it's a large amplitude of oscillation going down to the mid-range. You with me? So large amplitude of oscillation going down to the mid-range is grade 2. Grade 3 is a larger amplitude of oscillation going close to the end range. Larger range of oscillation going down towards the close range. And then grade 4, you need to go to the end mid-range and then do a small oscillation. It's a small amplitude of oscillation at the end range. So at each level, start from L5, apply grade 1, ask your patient if that's okay. If the patient replies to you, good, then you progress to grade 2. Communicate to the patient to check to see if it reproduces symptom. If it doesn't reproduce symptom, move on to grade 3. If again after application of grade 3, check with the patient and see if the symptoms reproduce. If the symptoms doesn't reproduce, then move on to grade 4. If even after all 4 grades, if some symptoms doesn't reproduce, then it's clear. You can clear saying that L5 S1 segment is good enough. So you check the function of L5 S1 segment starting from grade 1 to grade 4, and then you're clearing that particular segment and then move on to L4, L5 segment. Doing exactly the same procedure from L4 to L5, starting from grade 1 to grade 4. Making sure that L4, L5 segment there is no issue. Once you've done that, then move on to L3 segment and then do that from grade 1 to grade 4. Does it make sense? Now, one important information you need to remember is this. The important information is the direction of force should be perpendicular to the treatment surface. Whatever be the treatment surface, so the direction of force, if you notice me applying a PA glide, so the direction of force was perpendicular down. So I'm applying PA, posterior to anterior. Posterior to anterior. Posterior to anterior. You with me? Yeah? Make sense?